now let's talk about the influenza virus, or commonly known as the flu. So, influenza virus is a contagious respiratory pathogen that infects the nose, throat, and sometimes your lungs. So, it's notorious for causing seasonal flu outbreaks every year. So, the virus spreads through tiny droplets when an infected person coughs, sneezes, or talks. You can also catch it by touching contaminated surfaces and then touching your face. So the symptoms include fever, cough, sore throat, muscle aches, and fatigue. While most people recover within a week, the flu can lead to serious complications, especially in young children, elderly adults, and those with weakened immune systems. So the best way to protect yourself is by getting an annual flu vaccine. So vaccines train your immune system to recognize and fight the virus, reducing your chances of getting sick and spreading it to others. Also, always remember to wash your hands frequently and cover your mouth and nose when you cough or sneeze, and avoid close contact with sick people.
Norovirus, which causes gastroenteritis, spread through contaminated food and water and by touching surfaces that have the virus on them. It's very contagious and can make people sick with just a tiny amount. Good hand washing with soap and water is crucial to stop its spread. Nurses play a key role in preventing transmission by washing their hands regularly, educating patients about hygiene, isolating sick patients, and disinfecting surfaces with bleach. They also wear protective gear like gloves and masks when caring for infected patients and keep an eye for outbreaks to control the virus effectively.
The human immunodeficiency virus, or HIV, is an infection that attacks the body's immune system. It spreads through contact of blood, transfusion or transmission, semen, vaginal fluid, or breast milk. And to fight with its spread, the use of condom and not sharing of needles and following standard precautions in healthcare settings are crucial. There are preventive measures like having a vaccine, but currently there's no cure for HIV. Once you have an infection, your body can get rid of it, but there are medicines that can control HIV and prevent those complications.
Hepatitis B virus, or HPV, transmit through blood or bodily fluids. Precautions include vaccinations, using barrier protection during sex, and careful handling of sharps.
Measles is a highly contagious viral disease caused by the measles virus, characterized by symptoms such as high fever, cough, runny nose, red eyes, and a distinctive red rash that typically starts on the face and spreads downwards. It is transmitted through respiratory droplets from coughs and sneezes of infected individuals. Measles can lead to severe complications including pneumonia, encephalitis, and death, particularly in young children and immunocompromised individuals. The disease is preventable through vaccination with the MMR, which is the measles, mumps, and rubella, being highly effective in providing immunity. Widespread vaccination efforts have significantly reduced the incidence of measles globally, though outbreaks can still occur, especially in areas with low vaccination coverage.
When it comes to SARS-CoV-2, the virus behind the COVID-19 spreads mainly through respiratory droplets and aerosols emitted when an infected person coughs, sneezes, talks, or breathes. Transmission is particularly risky in crowded, enclosed, and poorly ventilated spaces. In order to prevent its spread, vaccination is crucial as it significantly lowers the risk of severe illness and transmission. Additional precautions include wearing masks through block droplets, maintaining physical distance to reduce inhalation risk, and practicing good hand hygiene by regularly washing hands or using sanitizer to prevent the virus from entering the body via touch.